got my katana.
Oh, whoa! I Show Speed's Extreme Balloon Emergency, Logan Paul's kick to the face, and a whole slew of other popular YouTubers and their unexpected medical moments. Today, we are breaking down and reacting to all of the accidental injuries from some of your favorite YouTubers. Let's dive right in.
Here we go. 3, 2, 1. Here we go. Oh!
Oh, this type of injury, when something hits you, it actually doesn't like scalp you. It's not like a razor blade. The pressure of the object falling on actually causes the tissue to rip and like explode open. Some people, it doesn't go all the way through and you can actually see some fibrous connections and you can just bandage it together, versus if it's truly split open, we need to put it back together.
The entire hoop comes crashing down and hitting me in the side of the head and cracking my head open. This hoop is so freaking heavy, probably 60 pounds of pure metal and wood just coming down, hitting me in the side of the head. There was actually a lot of sharp metal and wood on this hoop that I didn't even pay attention to because I didn't think the thing was gonna hit me in the side of the head.
We also worry about intracranial bleeding and skull fractures. So we will assess an individual, nausea, vomiting, dizziness, lightheadedness, confusion. So we need to do a CT scan of the head to make sure there's no internal bleeding. Take a look at the skull to see if it's fractured or not.
Cut on my head was about 1 inch. I know it's blurred out, but it's just nasty and I don't want to show you guys.
Blurred out, but laceration to the back of the scalp. Very common. People fall down. He has a unique bandage there because it's able to stay on. It's really hard to put a bandage on somebody's head, actually, because of the roundness of our heads.
I got my katana.
Oh, grabbing with the right hand as it's slicing to the palmar aspect of the right hand. The palmar surface is mostly soft tissue, but if you get deep enough, you get really worried about tendon and muscle function because there's all different connection points of where we can actually move different joints.
The other day, I attempted a backflip on a dirt bike.
Oh, was that fast enough? Oh, oh.
But I got in a terrible accident.
Arms are out in a position to brace himself, which is great, but this is the foosh. Fall with an outstretched arm, increase the risk of fracturing your wrists or your forearms, elbow dislocation, shoulder dislocations.
We had to call an ambulance.
So we're gonna have to get you onto the stretcher here.
I put him in a seat collar. This is actually a really, really, really nice collar. So this is called an Aspen collar. You can even zoom in, it says Aspen on the side. These are the collars that we'd actually put somebody in after we confirm that they have a cervical spine injury.
I'm still waiting to get everything set, get my arm.
Maybe there's somebody on scene for them.
Cast, all that good stuff. You can see the x-rays.
You can see that there's a fracture going straight through the radius. You see that there's almost like a little bit of buckling on the other bone next to it with a faint crack. So that's another fracture as well.
How many balloons it take for me to fly?
Oh, this was recent.
Let's go!
Somebody falling greater than 3 times their height. His head is at 3 times his height. It can cause some pretty good injuries. Concern would be, are you landing on an object? Are you landing directly on your feet? Are you falling in a unique direction? If you're landing directly on your heels, you worry about calcaneal fracture. You can actually disperse that energy all the way up to your neck. We worry about fractures to the cervical spine, the lumbar spine, or thoracic spine. So we'll palpate somebody's back to see if there's any point tenderness and get any imaging where there's tenderness. No loss of consciousness, but there's a concern of could he have hit his head on the ground? Is he altered? If that's the case, then you potentially would get a CT scan of the head. Uh-oh. Oh, what happened?
Reporting live on the canvas floor of Danny Aarons. You've hurt yourself here, Danny.
Hello, everybody. I have no idea what happened to me, but I can't move my legs.
It's a patella dislocation. This is a patellar dislocation, so your kneecap. And you see that the knee looks off. If you were to examine this a little bit closer, usually it goes lateral and the disc actually shifts up into this unique position.
The fight was kind of 50-50. You were landing some good shots in there. Do you think if it continued, you would have managed to get the score of knockouts?
Who the cares, man? I just go to hospital.
It's quite easy to fix. This is something that you literally will do 2 motions at the exact same time. We put these back in when people come to the hospital all the time. Oh, that's not a good idea. You gotta fall.
Oh, just dislocated my finger.
Typically, when we see somebody come to the emergency department with a dislocated finger joint, it's 45 degrees the wrong direction, and most of the time the dislocations go laterally or medially, so they go to the side. Hard to see dislocation of the finger, actually.
You see it? Oh.
Majority of these go back in relatively easy. Sometimes we'll just do a nerve block to the finger to reduce the pain. But what ends up happening when they get dislocated, they shift and get stuck on the side of the joint. So you need to be able to bend it a little bit further, lift it up over, and have it slide over in that area. Oh, a foot to the face. Your body heals best when you give it the tools it needs. And one of the biggest healers is sleep. It's one of the reasons I created Do Not Disturb by my company Life Happens, designed to help you relax, support healthy sleep, and wake up feeling refreshed. Check out Do Not Disturb at lifehappens.com or on Amazon.
Oh, he kicked the living out of me.
Sticking a foot to somebody's jaw, that can cause a lot of problems. You can cause a cervical dislocation of the neck, you can fracture the mandible, which is your jawbone. You can lose some teeth, cause a laceration to the inner part of the mouth.
I was using this saw and I made three mistakes. This guard keeps your hand safe from the blade.
Yeah, kinda-ish, not really.
I had raised it so that I could do tinier little cuts. That of course naturally puts my hand in a very perilous position.
You can see on his ring finger, he has an angled injury on that side, and then the pinky is cut off, and then some distal injury to the middle finger.
All it takes is for me to be working on some wood, I take a break for a second, get a notification, bing, what was that? Accidentally trigger it, and that was it.
We see patients who come in all the time, get distracted, and then they have injuries. Please be careful out there. Follow all the safety guidelines. Wear equipment appropriately, put a helmet on.
I'm looking down and I'm realizing this is bad, this is bad. This is forever.
A lot of times people don't realize that we can't reattach a lot of parts, especially distal parts of fingers. They're very hard to do. The body doesn't take, but always try to bring the piece with you. That way they can at least take a look at it and see if it's something that's viable.
So I grab paper towels, call the ambulance 911, remembering that there's a lot of me missing. But where did it go? I reach down, pick up out of the sawdust the tip of my pinky finger.
Transporting it, right? What do? You don't want to put it directly on ice, but you do want to put it in like an icy bath. Maybe wrap it in gauze, put it in a bag, and then put that bag in like an ice water type container.
Fortunately, what the doctor has to say is that that little pinky bit that's covered in sawdust is not a clean cut, so it's gonna be hard to attach.
It has to be a very clean cut. That blade is actually pretty thick.
It's pretty thick.
So it's actually cutting away a lot of tissue as well. The angle at which it's cut and the way that's cut, and it kind of rips and grabs, it's not a clean cut, and it's a lot of mangled tissue, which makes it very difficult to reattach.
Dr. Sullivan worked on me for 3 hours. It was a long 3 hours, but that night I was able to go home and sleep in my own bed.
That's probably a hand specialist. ER doctor is also running the rest of the emergency department, so it can't really be taken away for 3 hours to handle one patient. They have probably 15 to 20 patients at the same time. When somebody has extensive injuries that require a lot of time and dedication and specialty, you're gonna call the specialist.
I'm gonna be doing fidget spinner versus my cheek like she did. Now I'm a little bit worried because it obviously messed, that.
Yeah, don't do that.
You can't do that.
Don't do any lacerations to your face. Yes, the face will actually heal better, but you're gonna have a scar on your face. No matter what, there is going to be a line there. No, it'll just stop. Thank goodness. It'll hurt and maybe cause a bruise, ecchymosis.
Ecchymosis.
See how I was making fun of that girl for fidget spinning her face and it not looking real?
It's a decent amount of blood. Look at his shirt. He's got some blood on his right shoulder. Put a lot of pressure on it. If it continues to bleed a lot or there's a gap, you're probably going to need it closed. Many different ways to close it. You can use suture material or stitches. We typically won't use staples on a face because of the holes that makes.
I don't have a Band-Aid, so I'm gonna have to run to the store and buy a Band-Aid.
Put pressure on it. Get some sort of cloth, bandage, not a Band-Aid, but something to put pressure on it to soak a little bit up of the blood to get the bleeding to stop. If you put pressure on it long enough, it will actually stop. Whoa, that's a big rifle. It's not gonna be good. Gonna be thrown backwards. Oh! Somebody left the screw out. He's wearing safety glasses, thank goodness. I've seen plenty of eye injuries where people weren't wearing safety glasses.
So when I pulled the trigger, the gun exploded almost immediately. This cap hit me right there. The other ear hit me right here in the throat.
Oh, wow. They stapled his neck shut. If somebody came in quite stable, I would sew this together. But this patient probably went into a trauma center, and because it's the neck, they probably had to do a very vital section of your neck where your major blood vessels are sitting right underneath there, plus the anterior structures like your vocal cords and your airway.
And then punctured a hole in my right lung.
The apical component of your lung does sit up that high. It could be from either a direct puncture, fractured rib, or just trauma to the area due to force. Obviously, he's got a splint on his nose, so he must have had a nasal fracture as well.
As for my hand, my best guess is this is what did it.
His splint goes all the way out to his fingers. That gives away that there's possibly a finger injury or a metacarpal injury because you want it all the way out so it doesn't move. Versus if it's just a wrist injury, it'll actually just come to this part of the hand. Oh, ow!
It's torn.
It might not be as bad as I thought, though. Yeah. Oh, yeah.
Oh! Just the fact that the way that he's walking, the fact that he can't put pressure on it is not just related to the ligaments, but also the meniscus.
If I had to guess, I think it's
Which, ACL?
definitely your meniscus and the MCL, and I think the ACL is too.
I did a triple whammy? That's great. At least I have this prime.
God, that's horrible. Terrible triad is what we call that when the medial meniscus, the medial collateral ligament, and the ACL are all torn. And that's typically getting hit from the lateral aspect or the outside aspect of your knee. It kind of pops open.
Oh, that was pretty close.
Are we cutting fruit? It looks like we're cutting fruit. Oh, I see the red stuff. I like the 911 call immediately. Sit him down, calm him down, grab whatever you can to put compression to the area. You don't need to see what you cut. You need to stop the bleeding.
Oh my God! Oh, that was not a good idea.
Ooh. Finger's still intact, but you can see him shaking and he's dripping pretty good. The major blood vessels of your fingers are actually on each side of the finger. So if you hit that, you can actually hit a little arterial vessel and they'll bleed pretty quick and be dripping and cause a lot of discomfort. Plus, the nerves run right next to all the blood vessels, so you're gonna cause some pain.
Lance, come on, let's go. Let's go.
If you put the dry tissue on there, it's gonna stick to the wound. I would just wet it. Blood gets very sticky.
Is it sticky?
You can break a car window with your fist.
Don't do that. Don't do that. Oh my gosh. All I can think about is the amount of fractures that someone's gonna have in their hand. I mean, at least they're using something to protect their hand, but if they break the glass, it could shatter, could smack pieces of glass in your eye, and then you lose your eye. So please don't do this. Oh, he's gonna lacerate his leg.
Oh.
Yep. Oh, there it is. On the medial aspect, high up there, that's when the femoral artery starts cruising down a little bit more deeper, but something to worry about as well as the veins there. Gotta be super careful. The veins are much more superficial.
I just pulled a big piece off. Might need to go to the hospital. You gotta go to the urgent care. You're gonna need some stitches. Let's get you into the car.
So that's pretty good. You went to urgent care first. Some urgent cares can fix this, no problem. Some will send you to the emergency department. Urgent care is a fast track kind of business where people come in and out quickly.
Max getting stitches right now. That was a awful way to start the day.
Very good for the doctor. Very cool. It's got one of those camping headlights. Very useful.
That was a stupid thing to do. That was a stupid bit. And creating entertaining content, we sometimes get carried away. That is a lesson learned on getting carried away right there. Max is a trooper though. He said he wanted us to keep going.
Keep busting myths, boys.
Please, if you're busting myths, make sure you do it with safety precautions and understanding what the worst outcome could be. What did he do? He obviously didn't hit himself on anything outside of the mattress on the ground, but landed sideways and could also cause a little bit of shifting. Unlikely to cause a dislocation, but again, these are all things that you think of.
I think my back cracked. Ah! Oh, I think my back cracked.
Good sign is up walking around. The crack that he's describing is he thinks that he broke a bone. So your back can crack and make noises like going to a chiropractor's office. Typically, you have to have trauma to your back.
My back.
Not spinning, flipping, turning, twisting.
I swear to God, bro.
Lower back pain is like one of the #1 reasons why people can't work. If you do have a lot of pain, make sure you see your doctor. Make sure you go to the ER if it's an acute problem. Oi, missing.
Did I actually hit you?
Yeah.
Sorry.
Ah, see, I knew they were missing. Close hand fist to somebody's face. You can fracture your hand if you're hitting somebody's bony structures.
Bony all behind!
Try not to punch people in the face. People are not for hitting. Oh, he did smack him in the head.
I literally felt my nose crack sideways.
Did I break it?
And then I moved it back in the other direction. At least it looks realistic.
Yes, you can snap the bone and you can push it back and you'll feel crunchiness, not fun. You will typically swell up and you will have blood go down each side because the lamina pectoris, which is a type of bone in the middle, will actually fracture and the blood will seep down.
I'm gonna have an Owen Wilson nose now.
Wow. So these are good clips to react to. Hopefully you guys learned something of what to do and what not to do in certain circumstances when it comes to dangerous situations. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.